Often people come in and mention how they're embarrassed of their teeth and are very conscious in photographs or when they're out in public talking or eating. There can be some very simple solutions to your concerns. Well, we have to start off at an assessment and planning phase again. The assessment phase has two components to it. There's the clinical aspect where we'll be checking whether we can use the teeth as they stand or whether there's any other factors that come into play. Do we need to move the teeth slightly? Are there any teeth that need to be removed? Is there any underlying disease, gum disease or tooth decay? Or perhaps some finer components such as the gum line or the gum edges that may need a slight bit of adjustment. But one of the major factors of the initial assessment phase is understanding what the patient wants and if we're able to deliver it and how we're going to be able to deliver it. Once we agree on treatment and a way forwards, there's two pathways really. So if it's just a simple case, we can move forward quite quickly. We'd usually have an intraoral and a digital mock-up so we can make an assessment of what your teeth would look like. And it's quite nice to see it done in your mouth because having it on a computer is a little bit abstract, but we tend to do both. So if it's a simple case, we can move straight ahead with the preparation. You might have a provisional phase where we have temporary teeth finished to a very high standard, but you can take that home and see what it looks and feels like. And then we can quickly move on to the definitive phase, adding any minor adjustments that you might have needed. If it's a more complicated case, of course, we have to deal with the underlying issues first. So gum disease and tooth decay have to be stabilised. Any teeth that need to be removed need to come out and the area needs to heal. And we may need to provide some orthodontic work because the teeth may be angled or tipped in the wrong way, which makes it very difficult to get a nice result. So from there, once disease processes are stabilised and the teeth are in the right position, again we move on to the treatment phase where we prepare the teeth, provide provisionals, and then move on to the definitive phase. Once the treatment is finished, then obviously we really want to look after your new teeth as best as possible. So we'll have a maintenance program that will usually involve having regular checkups. You'll see the hygienist regularly, and we'll provide a bite guard or a splint to make sure if you're grinding your teeth, then you won't be chipping or breaking your lovely new teeth. The time frame of the treatment really depends on, again, if it's a simple case with no underlying problems, it could be just a matter of a few weeks from start to finish. If it's a more complicated case with underlying issues, it could take a few months to many months. Of course, one of the concerns is how painful would treatment be. Generally, the treatment is not comfortable, but it's not painful because you'd have local anesthetic, your teeth would be numb, and if you can feel it or it's uncomfortable, then you should ask the dentist and they'll stop and address the issue. After the treatment, because you would have had your mouth open for quite a while, you might feel a bit stiff and a bit bruised, but it's very manageable with painkillers, and after a few days you should be just back to normal. Most people are at least slightly nervous coming in to see the dentist, and that's perfectly natural. We try to manage that with their expectations and how we address them, how we approach the treatment. But if it's not possible and you're very nervous, we have different sedation options available to us. So that could be oral sedation, which is just a little tablet, or it could be IV sedation or inhalation sedation, which is happy gas. Sometimes people ask me, is the treatment worth it? And that's a very difficult question to answer. But I think seeing the outcomes and the results and what people say after they've gone through the treatment, they will generally say it's made a difference to their everyday life, and that's a really good thing to see.